Dumelang, Salbonani Makadi. Greetings, ladies and gentlemen, and welcome. Thank you once again for tuning in to Dr. Truth's podcast. This is the one, the only, the international, the host, Tinaishe Mhlanga, aka Dr. Truth. And welcome to Dr. Truth's podcast, the one platform where we keep it fun, we keep it moral, and we keep it informing. Ladies and gentlemen, it is the month of September, the month that is celebrated as a Hydrocephalus Awareness Month. And of course, Children's Cancer Awareness Month. So, ladies and gentlemen, as we are coming to you at this time of the year, we just want to bring some awareness in light of, some central nervous system disorders, particularly in this instance, hydrocephalus. Maybe some of you might have heard about it, or maybe you might not have heard about it. But well, this is the platform, and of course, we are going to be discussing it in depth, and I have a guest today with whom I'm going to be delving deep into. But before we can introduce our guest, I want to say don't forget to like, to subscribe, and to share the link so that we continue to grow as a platform. So ladies and gentlemen, today I'm joined by Simbarashe Chitsunge, with whom we're going to be discussing today's issue, that is a hydrocephalus. I wouldn't really want to spoil the profile, for the audience.
Yes.
So just, allow you to just introduce yourself. But I must say, pleasure to have you. And, it's been, I don't know how when we've been postponing and finally we've had this opportunity. So I must say, thank you for affording the time, and it's a pleasure to have you. Maybe just a few introductions for audience before we proceed.
All right. Thank you, Dr. Truth.
Yeah.
It's nice to meet you here. Finally, like you said. Well, my name is Simbarashe Chitsunge. I'm a 50th-year medical student at the University of Zimbabwe. I'm well interested in neurological sciences. So it's a great pleasure and opportunity to be here with you today for the Hydrocephalus Awareness Month.
Yeah, interesting. Thank you so much for that brief introduction. 50 medical students, they know how to keep it short and precise. But I know that's fine. Okay, so we concerning every situation, or concerning every concerning maybe a lot of our medical issues, we always get myths and that, stories and this and that, probably this, probably that, maybe. So going into these neurological disorders, what are some of the myths that that as surround that field?
All right.
Particularly central nervous system disorders, neurological disorders, and I don't know, maybe hydrocephalus in particular.
Yes. So hydrocephalus, we define it as accumulation of fluid in the brain, but specifically in the ventricles of the brain when we dive deep. But then now, because hydrocephalus is more of a congenital disease, and so most of the patients that we receive who present with hydrocephalus are babies. Most of them, the population are usually small child babies, usually in the first year of life. So now, in our community, there are different viewpoints. We have people who believe that probably the child who comes in with hydrocephalus is a cursed child. Yeah, they say in Shona Zinza, Vakaroiwa. So then now we have a challenge. It's a very big challenge to the community and also to the health field. We have patients coming late with a presentation that is now beyond repair. We can try to correct it, but the reversal of the brain damage that has been done is difficult to reverse.
Such that the outcome it's not as good as it could have been if they had presented earlier on.
That's very true.
Is there anything else probably surrounding the area?
There is another thing that we might find interesting to talk about today. There's an issue of lumbar puncture.
I've actually heard.
You heard about it.
I've heard, and I've also heard it's somewhat controversial.
It's very controversial. We have been in situations where patients come in presenting with meningitis. Meningitis is an infection in the membranes that covers the brain or the brain itself. So we have a patient coming in, and we're suspecting meningitis. They have neck stiffness. They have the symptoms that they're presenting with is pointing to meningitis. But now our gold standard investigation on that is CSF. And to obtain CSF, we need to do a lumbar puncture.
Okay.
But now people, to get patients to consent to that, it's a very difficult step. That's the most difficult step. They believe kuti kutorwa kwemvura yekumsana will result in the patient dying or maybe
hapana zvekuti pamwe mvura inozotengeswa here kana kuti inoshandisa kupfumisa vanhu.
Not necessarily. They won't be thinking that, but I think they have this misconception. They think that kutorwa kwemvura kumsana kunoitwa kuvanhu vakuda kufa. Saka munhu akatorwa mvura kumsana probably akutonofa. And not only that, vamwe vanobelieve kuti hanzi pane damage inogona kuitika, then munhu anopedzisira aremara asingachafambi and then spend the rest of their life in a wheelchair. But there is no.
What are the numbers? What do you think are the numbers of lumbar punctures that really go south? Is there, can you say really, okay, 5% of people who do lumbar punctures may probably experience something, or the numbers actually very slim, close to insignificant?
Well, according to research and recorded values, 95% of the cases where lumbar puncture is done is always successful. The remaining 4 to 5% is only that after lumbar puncture, patients experience some mild headaches. The mild headaches will be due to differences in pressure dynamics. CSF, when you take fluid out, pressure sort of decreases. So that tension causes just a mild headache and it will recover. Only that. And it is, in most cases, when we do CSF lumbar puncture and obtain the CSF, and then we send it to Lancet Laboratories, and they do their investigation and they confirm the diagnosis of meningitis. The mortality rate kufa kwevanhu kunobva kwareduciwa because now we know what we're dealing with, and then we can target our therapy towards meningitis. We give antibiotics, the patient recover.
All right, no, that's fine. So, ladies and gentlemen, I thought it was necessary for us to probably demystify a couple of things, pertaining to these neurological disorders. And actually, I have, the lumbar puncture is not, it's not the first time that I'm hearing about it. And I would want to say, if you also want to probably go get in-depth information concerning the lumbar puncture issue and demystification about it, you can check out the Podmyth podcast on lumbar puncture kutorwa mvura kumsana. They have a full video on that. Unfortunately, we can't really go at length about it today, because today we have a bigger problem that we have to tackle here, and that is Hydrocephalus. So Chiremba, you gave us a dose of what Hydrocephalus is. So maybe probably just to build up on what is Hydrocephalus, how does it come to be, and maybe to start with that, what is Hydrocephalus and how does it really come to be?
Right. So like I said before, Hydrocephalus, we define it according to the health standard as accumulation of CSF in the ventricles, right? So this fluid is the same fluid So it's produced in the ventricles in the brain, musoro, right? And then it circulates in the brain and the spinal cord through certain canals, pipe in our mother language. So now what happens in Hydrocephalus is, if the one thing that produces Hydrocephalus over secretes or over produces via one dis, and that's one way. Another way is if those canals, those pathways in which the fluid can travel through, which end up in different parts of the brain, even the spinal cord, if they become blocked, then it accumulates. Imagine Tinaishe Mhlanga block your pressure. So now when pressure builds up and the ventricles are actually not storing a producer, they become bigger. Then akava bigger, it means even sorrow man and then now when people see that, especially the mothers, they panic. They panic a lot, and then they get these meats, they go kunana kuna profita kunanga and stuff, and delay kuya of which the number one thing to do is just to come to the hospital and then see the surgeon. Correct.
Alright, no, that's fine. Okay, so all right, so there is like some risk factors that probably give rise to this Hydrocephalus developing, or risk factor the mother was in good health, or are there certain risk factors that can probably predispose the patient to having Hydrocephalus?
Well, there are risk factors. There are risk factors. So in this case, I will classify my risk factors. They are congenital and genetic. These ones, they occur sporadically. it's not something that is invited or chatinochuza. Yeah, of course it's chinongouya, tina zvataita, the mother is in good health, and then the child is just born like that. Zvangoitikawo. And then there are other acquired conditions. So my acquired conditions ndeyekuti maybe mama pavanga vakazvitakura nemwana during that antenatal phase vakaita ma-infections. And then ma-infections atinonyanya kutaura nezvawo tinomati ma-torches, toxoplasmosis, rubella and stuff. They are viruses. Saka anogona kukonzeresa kunobloka kwemacanals ayaya and then result in CSF accumulation in the ventricles. Kunogona kukonzeresa futi over secretion. And not only that, kana mwana akaita meningitis, achiri mwana mudiki, first year of life here. Meningitis yatange tichimbotaura nezvayo. Mwana akaita meningitis, kana ikasadiagnoswa zvakanaka, and pane inoitika inonzi post meningitis hydrocephalus. Inokonzeresa kunarrowa kwemapipes aya, and then CSF accumulates, then kana accumulate mwana akuita hydrocephalus. And the only way to prevent that one is to properly diagnose meningitis through kutorwa kwemvura kumusana and then treat it well. Kana maitreatawo, then risk inobva yadzika.
Right. So ladies and gentlemen, I think yeah, we're getting somewhere, and we are seeing that kutora kwemvura, it seems like central part
it is the central part in
neurology, right? Okay, no, that's fine. So Chiremba, maybe if you can tell us, is hydrocephalus chirwere chevana do we expect to find it in children only, or can even adults actually suffer from hydrocephalus? Since the easiest sign to see that maybe munhu anogona ngane hydrocephalus is because musoro wemwana urikukura, right? But I don't think that would be the same in an adult. We can't see that the head is growing big, right? So are there is it can we find it in elderly patients, and probably what are the signs that can tell us kuti, because munogona kutongogara makagara kapa makatorohwa nayo hydrocephalus tichitofana tinge tichitotora chimvura yekusana, right? So yeah,
that's very true. That's an important question,
right?
So there are two extremes of age, pediatrics and geriatrics, and so vana vadiki nema elderly vana gogo vaya, and ndo vari more prone or susceptible to getting hydrocephalus because of age, like I said before. And also vanhu vari pakati apa middle aged, our age isusu, yeah, we can get it. It is possible. Hachisi chirwere chiri specific, but I can say it's more common in the pediatric population and in the geriatrics.
So now what signs probably can a child also present with, apart from a growing head circumference, and even the adults? What can you see? What can we see?
So let's start with the pediatrics and kuvana, besides kukura kwemsoro, and because like we said, the fluid is accumulation in the cranium, and mune mvura iri kuwanda, saka pressure iri kuwanda. Usually vana mama vechikuru vanotarisa nhova yemwana, the fontanelles, kuvana zvinenge zvisati zvavhara zvinhu izvozvo, saka nhova yemwana inofanira kunge ichitamba so, and but when they have hydrocephalus, nhova yemwana kana vakaitarisa inenge yakangobhauja so, inenge isingatambi because of pressure elevations inside, inobva yakwira, inobva yangofuta yomira yakadaro. And besides that, vana they get difficulties in feeding, and vanotanga kunetsekana nekufeeda kana mwana achiyamwa, when they try to feed they vomit, vanobva varutsa. And then kuvanhu vakuru, especially the geriatrics, vanotanga kuita zvakaita sana dementia and brain degeneration, and kana vane matumors, then they start presenting nema symptoms anoenderana nekuti pacho pakabloka kana patsikirirwa ndepapi. And if it's the cerebella, they start presenting with gait problems and speech problems. And yeah, so it all depends kuti symptom iri papi kana tiri kuvanhu vakuru, but kuvana they're not specific.
Okay, well, no, that's fine. Okay, so thank you. All right, so maybe as we move on, maybe probably it would be important, because maybe before we get to how maybe intervention and stuff like that, I think it's probably important for our viewers to know what are the consequences, the negative outcomes, because we know that people will delay, right? That's the reality of our setting in Zimbabwe. People will delay. People look for alternative means to to dealing with the situation. People look for alternative ways of probably getting treatment, right? But what are the implications? What are the negative outcomes of delaying or delaying initiation of treatment, because of course you mentioned something to do with brain development and something like that. Maybe if you can build on to that, what else, what are other negative outcomes that we can get, so that our viewers get a proper a full picture, or to understand that why should a child, or why should the parents present at the earliest that they suspect that the child may be having something wrong with them.
Right. So I'll start again with the pediatrics, and we are more worried about the pediatric population because they experience anything in their lives. They have a lot to come. They have a lot to look forward to, and future usually it's in our hands. It's in the parents' hands, and so mwana kana akatanga kuita challenges nekufeeda. Let's just keep it general like that, and anobva not malnutrition. There are the nutrients that we expect to mwana kana achikura anga achiwana, ma proteins, ma carbohydrates, micronutrients, ma vitamins, and so when they get difficulties in feeding, or when they vomit, and my nutrients are and they get stunting and malnutrition, izvozvo zvinobva progress and worsen more brain development here. Mwana akura oenda kuchikoro magrades ari low, anobva atotadza kupasa kana form 4 chai. Future yemwana, economic yake, economic status is very low because of that. Of which zvinhu zvekuti zvingadai zvapreventwa early, and so you keep children in vicious cycle of poverty, and you start blaming other things which have nothing to do with that. Imichingoyeni mwana kuchipatara,
mweya inotambura nekushora mweya wakati, when all this could have been avoided by early presentation. So ladies and gentlemen, our viewers back at home, I think we're getting the gist of the matter, that early presentation is really the central aspect of everything that we are talking about here. Of course, we had to go into how do we then manage this hydrocef, but the first step, the next best thing, if you see that this something is probably not okay, present early, so that assistance can be given. Okay, so maybe let's probably delve into issues to do with the management or the treatment. What can be done for this child who has come, and or maybe probably just before that, can they live a normal life? Can they lead a normal life? And what can be done for these children so that they life here, it normal or near normal?
All right. So when it comes to prognosis, or kuti vachararama normal life or a bit abnormal or reduced life expectancy, depends on mainly when is the presentation and when has the parent come nemwana kuchipatara. And usually we encourage viewers or anyone with a child suspecting hydrocef kuti auye nemwana in the first year of life, and the earlier the better. And kana mwana early, then it means now the doctors, the surgeons can now intervene early. Brain development yatanga chitaura aicha intervene hydrocef. Now they can develop properly and well, so they become normal. And so if intervention is implemented early, then I assure you, manandra a very normal life. There won't be any difference. And when it comes to treatment or management of these children, surgeons, the gold standard of treating hydrocef is putting a shunt. And shunt ndeye kuti tabloka panofamba ne fluid here, and then now we insert a shunt. Shunt ndeye kutonoisa a tube or a canal, artificial, per ventricle, and then it starts draining the fluid to where we channel it to. Usually when we channel it to the peritoneum, kana to abdomen, kana to mudumbu, let's say, and pamwe channel it to the chest, pamwe to the heart, and so kana channel fluid here inozobva yabuda through urine, and mwana pano inoweta inobva yabuda, and then now we help to reduce the pressures. And if it's done early, most cases they do live a normal life.
Okay. Saka muruguti, you're saying for this shunt, a child gets to live with this shunt probably for the rest of their life. Is it a temporary, is it a makeshift type of arrangement? Could maybe the doctors are eventually going to go in to do something, or itoriye kutoti tikatokisa shantika watu are right, you can upenyu wako watu are set.
So it depends on the type. It's also classified hydrocefs actually depending on the cause. And so pani yavanoti endoscopic third ventriculostomy. It's another way of trying to manage this hydrocef. And but however, on the shunt management, and kana mwana aiswa shunt, we encourage mothers or any caregiver anenge achiona nezvemwana yeye kana anzi dzokai ku review in a certain period of time, let's say a week or two, vanofana kustika to that. They have to come back because there are complications that we are afraid of, like kana shunt here ikablock hydrocef here inobva yadzoka and then we don't want that pane chance futi yekuti mwana anogona kuita infection, you know, things like that, and we don't want that. Saka review inotibatsira kuti rule those things out. And not only that, when it comes to permanent or temporary, it depends kuti kana chiremba vari kuona nezvemwana uyu and kana mwana recover and recover adzokera ku normal state, and then they assess and then they see kuti there are no risks to develop hydrocef again, then the shunt can be removed. Mwana okura zvake zviripo without a shunt. But kana iri recurring, ichiramba iripo, isingamanage permanently, then we have to put a shunt for a very long period of time. Yeah.
Okay. Oh, no, that's fine. Right. So yeah, quite some knowledge there coming from our guest, Mr. Chitsunge. So, ladies and gentlemen, I believe kuti muri kubata something, right? Because this is set to benefit us, right, our viewers back at home, right? So, ladies and gentlemen, it's a collective effort for us, you know, to combat, you know, hydrocef. Because inongomuka chero payada, you know, that Mr. Chitsunge mentioned that it can be sporadic. Ngoti yangokaruka yatongouya. You see, so you know, we just need to be on the lookout. So whether mothers or fathers, right? You know, when the mother, it's maybe you have a situation where the mother is saying, baba simwana nengari pane zvisiri right. Then you know, baba vanenge vachingotsigamidzira kuti aiwa kuti mwana hakuna kwaasikuenda. So we need to, you know, come together and make sure kuti, you know, the future of our children, while it's still in our hands, you know, we act accordingly kuti tisazoshorwa. Okay, maybe tisazoshorwa as though we are at a parenting level, but I'm just saying kuti, you know, like from saying it from the position of a parent, kuti you know, vana vanozongoshora abereki kuti iwe bereki wangu vakandiendesa kuchipatara ndisiri pari nani, you see. So it's that's just what we are talking about kuti if you see the need, let's just see that intervention is done earlier on, and vanhu vabatsirike, right? So as we're drawing to a close, what or maybe I would want to know if there are systems in place to enable early detection of this hydrocef. Is there any possibility, is there any chance of us being able to diagnose a child of hydrocef maybe achiri mudumbu, or kutozongomirira kuti pamwe mwana azvarwa mai vaenda couple of days later or a couple of weeks later ndo paanozoona kuti apane zvisiri right, or there's actually some, you know, systems that are available to enable us to see that the child there's something not right with the child.
All right, so pertaining to systems that are in place for early intervention, they are there. So first of all, we encourage mothers during the antenatal period before delivery kuti vana mama ngavaende kuma clinics for checkups, right? This helps us to rule out infections. We talked of torches, and tichiti torches aya viruses and some bacteria can infect the mother, and that places the baby parisk to develop hydrocef. And so kuenda kuma checkups, kuma ANC visits, and before delivery kunoita kuti kana vana chiremba vakaona kuti something is wrong with the mother, vanobva vazviadressa early, and then they treat the mother so as to reduce risk could develop hydrocef. Not only that, pane scans ariko, ultrasound scans, and they are readily available in our system. They are very cheap, and so the ultrasound scans can be used to scan and visualize the baby achiri mudumbu. Then totarisa ma ventricles aya, totarisa brain zemwana, a proportion to see if the ventricles are bigger, and then we suspect mwana ane hydrocef. And then early intervention yoitwa, and then it won't now interfere with brain development zemwana. It will also put mwana pa advantage kuti zvisazonyanyoonekwa akura patomboitika a certain milestone. So they are there.
Wonderful. So ladies and gentlemen, I'm sure Tapabata early interventions are there, they are available. It's important for our pregnant mothers. Let's make sure that we visit the ANC clinic, and you know, ndo panoonekwa kuti hapana here mavirus, mabacteria that are infecting the mother, and also ultrasound scan, which will enable us to detect whether there is hydrocef or not. So very interesting and profound words coming from you there, Mr. Chitsunge. When I was running to a close, unfortunately, we just have to, you know, keep it short because, you know, time won't allow us. But we would, of course, love another dose of this, you know, high dose. Okay, so maybe your parting words for our viewers concerning Hydrocephalus, and mvura yekumsana.
Yes.
Lumbar puncture.
Well, my parting and final words to the public and the viewers is, first of all, on Hydrocephalus. If mothers are suspecting or thinking or have any clue that the child is not really growing well, he or she is not feeding well, and then the head circumference or the fontanelle is not really doing what it's supposed to be doing, I urge and encourage all mothers to come with children to the clinic or to any nearby hospitals as early as possible. Zvinobatsira vana chiremba to intervene and treat and address the hydrocephalus or any pathology that will be there as early as possible. Also, this helps with prognosis. Mwana anokwanisa kuzorarama normal life kana zvaadreswa as early as possible. Right. And when it comes to nyaya dzemvura dzekumsana, mvura yekumsana, like I said, it is the gold standard way of diagnosis when it comes to things like meningitis and encephalitis. So Lancet Laboratories is close by and everyone know where it is. Saka chinoitika ndechekuti kana tikasa agree to lumbar puncture, diagnosis haiti. Tichirapa munhu blindly without knowing kuti chii chaizvo chatiri kunyatsorapa. But when they agree and consent to that, it makes it easy for ana chiremba now to diagnose zvakaita sana meningitis and tailor the treatment towards exactly the cause of that. And so we do agree kuti tingava tine ma different perspectives when it comes to religion, social backgrounds, but ngatiuyei nevana kuchipatara. Ndosaka Mwari vakatipa njere dzekuva zviremba. And tinotenda naizvozvo, but ngatiuyei kuchipatara as early as possible. Those are my final words. Thank you so much.
Interesting. Thank you so much. Thank you so much, Mr. Chitsunge. There you have it, ladies and gentlemen, from Mr. Chitsunge, fifth-year medical student, aspiring neurosurgeon. Ladies and gentlemen, I don't really have anything to add, but to say, keep, liking, subscribing, Muchifambisa link. Otherwise, from myself, Tinaishe Mhlanga, aka Dr. Truth, and our guest today, Mr. Simbarashe Chitsunge. Ladies and gentlemen, we were discussing hydrocephalus and nyaya zongomuka, mvura yekumsana, lumbar puncture. So thank you so much for watching to the end, and thank you for tuning in. Thank you for subscribing, sharing, and liking all the content that we keep giving you. Otherwise, from myself, thank you so much. Stay hopeful, stay safe, and stay blessed. Dr. Truth signing out.
Bye.